Hi everyone, it's Brandy McCreary, and this is my week 3 discussion too. I'm going to go over the sources of power seen in an organization, and then also go over the uh, negative impacts on an organization when its members exercise power and play political games. So one of the articles that I read defined power as the ability to control outcomes, experiences, and the behaviors of others. Most healthcare organizations operate in some sort of hierarchy, and it's often misconstrued that those higher up on the organizational chart have more power or a greater ability to stimulate certain behaviors on other members of the team. Ultimately, though, powerful individuals can be located anywhere within an organization. It doesn't really have to affect or be directly keyed with their position within the organization. A hypothetical negative example of power happening at the staff level within a hospital would be an experienced CNA offering training to a new CNA, and within that training they're providing false information or providing poor care to patients, providing to that new hire that those sort of behaviors are acceptable when really they're not. There are many different sources of power, which include coercive, legitimate, referent, expert, and reward power. Coercive power involves either physical or inferred threat that corrective action or punishment will occur should the individual not perform the tasks or meet the standards of the one in power. Legitimate power, which is often viewed as negative because it indicates that authority is power. It's understood that those of higher social rank and organizational hierarchy influence the behaviors and ideas of those of lesser ranks within an organization, and it ensures that the hierarchy within the organization is understood and respected. Referent power can involve virtually anyone within a team or a group within an organization where the influencer is utilizing their own personal attributes to get others to do the same. A good example of this would be a CNA who goes above and beyond, providing excellent care to patients that is respected by both staff and patients, and encourages other staff members to go above and beyond and do the same thing. Expert power would involve two individuals, one of which is an expert to some degree, and the other that is seeking help from or information from that one that they believe is the expert. An example of this would be a charge nurse and a new nurse. The perception is that the experienced nurse or the charge nurse would have more information, more experience, more knowledge than the new nurse, to where the new nurse would respect the experienced nurse and go to them for additional information, and they would follow suit with whatever they would like to do. Lastly, reward power involves some sort of reward or incentive to change the behaviors of others, whether those behaviors be right or wrong. Our book indicates that an example of this would be a physician offering some sort of favorable treatment for following direct orders, whether a nurse agree with them or not. According to Henry Mintberg, his model of organizational behavior, there's many games that can cause negative effects within a healthcare environment. One of those games is budgeting, where managers or of specific departments use their position or legitimate power to falsify information to attempt to gain more funds for a future budget. Budgeting in general is often a sore subject because everyone knows that operating over budget often means budget cuts, and you could lose positions. So it would not be sufficient, though, for a manager to request and falsify information, requesting additional man hours to increase the next year's budgets. This will essentially produce much more heartache and job loss in the future when it is determined that the proposed budget was unnecessary. Another game that was brought forth by Mintzberg is the line versus staff, which is conflicts between managers and staff members that are not directly relating or even in the same department. This is often seen between medical, and this is often seen in my position between the medical surgical staff and other departments within the hospital. Managers from other departments, they're constantly advising staff on the medical surgical floor of wrong information and using coercive power, threatening staff that should they not do as they say, that some sort of punishment or a write-up will be done on them. For example, before transferring a patient up to the med-surg floor in my current place of employment, the clinic nurse or any other nurse from any other department to obtain a room number and give reports to the charge nurse on the med-surg floor. Per the in-house department transfer standard operating procedure, this is to be done before any patient is transferred within the hospital. This is often not followed. The clinic manager and the clinic charge nurse will often bring patients up to the floor without providing that information or getting that information from anybody first, and they often threaten write-ups for medical surgical employees for advising of the procedure and being reluctant to take on a patient that they have no information about. So there's many other games that are played that provide negative impacts to the organization, but those are just a few. Have a good week, everybody.